When I was tested, I thought everything is finished. But then I was told that there is antiretroviral, and I became happy. When you're positive, you have antiretroviral and your ARVs that you take. And if you take it perfectly and live positively, you'll be well today.
Rose Bouquet is a Nigerian. She is one out of the estimated 22.5 million people living with HIV in sub-Saharan Africa. When she tested positive to HIV 3 years ago, she was single. But today, she's married. Experts say she represents the optimistic future of HIV/AIDS prevalence in Africa.
The health system in Africa has done an enormous job, a wonderful job in tackling the HIV epidemic. I think just as recently as 5 years ago, there were very few people with HIV that were receiving treatment in sub-Saharan Africa, and now it's actually in the hundreds of thousands, if not more than 1 million, are receiving care and treatment.
The progress made so far in reducing HIV/AIDS prevalence in Africa has been attributed mainly to efforts of donor agencies in collaboration with governments. Nigeria's Minister of Health, Babatunde Oshosimeye, is of the view that African countries need to domesticate the treatment of HIV/AIDS.
HIV has been singularly lucky because it has benefited from a global movement for resources. But it's not going to be for long. And so we must share alike, we must domesticate it, we must make sure that it is well institutionalized.
In spite of the optimism expressed in regard to the reduction of HIV/AIDS prevalence in Africa, experts say there are still challenges ahead.
There are lots of healthcare providers who are in the urban centers, but when you begin to move into the villages, you go to the rural areas, they do not have enough human resource to work.
Countries that had the most cases of HIV had the least access to antiretroviral drugs, and this was simply not acceptable. Something had to be done to bring these life-saving medications to the hundreds of thousands, if not millions of people who lived in poorer countries who needed them.
For Africa to meet the Millennium Development Goal 5, which has to do with combating HIV/AIDS, malaria, and other diseases, experts say governments must have the political will to strengthen their health systems. Omotola-Aderinsola for AIT News.